Greetings, everybody, and welcome to Birth of a New Earth. My name is Jeanice Barcelo, and I'm going to be your host for this very, very important show. I'm very excited to be presenting with Naturally Better TV, and this is going to be the first show on this new station. And I have an incredible guest that's bringing forth some very, very important information we really all need to know about this. His name is Dr. Paul Byrne. And Dr. Byrne is a neonatologist. He's been involved in medicine for decades, and he is amazing in terms of his concern for the protection of life from conception until natural death. And we are going to be talking about what passes for organ donation today, so that we can expose what the medical system is really up to with this very, very dark energy of harvesting organs. So Dr. Byrne, welcome to the show. I'm so glad to have you here.
Janice, happy to be here with you.
Dr. Byrne, can you tell everybody your website?
Yes, our website is www.lifeguardianfoundation.org. And we are an organization that protects and preserves life from true conception until true death. And those words "true" have to go in there, because the words are there and they do have meaning. And but what's happened is that they have distorted both of those words. The first word, conception, that obviously is known to have occurred when there's just one cell there. We call that first cell the zygote. That's really a one-cell organism at that time, and the proper label would be a conceptus, a human conceptus, and the life is a continuum from then on until true death. In your introduction, you used natural death. There's many people using natural death, but if you just take an example, Terry Schiavo, who had her death imposed by taking away her food and water, she suffered a natural death, but it was an imposed death. And so we have to use true death, and true death is when life on Earth has ended, and it would be life for the whole organism, not just life that you might see in the flowers that bloom, or the trees that grow, or in the dog or the cat that runs around. They have life too, but the life of the person, the human person, is so special. And that life, once it begins, it's a continuum until death, and until true death. And in medicine, doctors have been given the duty to pronounce death, to certify death, and at least until very recently, it was only the doctor who could certify death. And we learned about declaration and determining death when I was a medical student and a much younger doctor. We learned that we didn't declare somebody dead when their heart was beating, or when they were breathing, or when they had any kind of response. We knew to be very careful, because it would be wrong to declare somebody dead while they're still alive. Well, what occurred over time was that the doctors, the medical world, at least those who were involved with it, wanted to do heart transplant. And so they tried to do heart transplant from cadavers, but it never worked. So then Christian Barnard was the first doctor to do a heart transplant in Johannesburg, South Africa. And he cut out the heart, essentially the beating heart, and transplanted it. and got much notoriety for that heart transplant. Well, 3 days later, they did the second heart transplant in Brooklyn, New York. And they cut the beating heart out of a 3-day-old baby and transplanted it into an 18-day-old baby. And at the end of their procedures, both babies were dead.
That is
So
insane.
it was illegal to do it. It was immoral to do it. And so then they wanted to make it moral and legal. So their method of doing this was to set up a committee at Harvard. And the Harvard committee just invented brain death. And brain death is a mendacity. Mendacity is not a commonly used term, but it's a term that's been around for a long time. Fact is, when I came across it not too long ago, I looked in the dictionary, and I have many dictionaries, but one of them is an 1867 Webster's dictionary. It's the 5th edition of Webster's, and mendacity is in there. And what a mendacity is, it's a lie, a deception. And that's what brain death is, a lie, a deception.
So let me ask you to pause for a second to make sure that I'm understanding everything that you just said. So we have doctors who have taken organs out of people that are living, including 3-day-old infants, in order to legitimize the murder of living people in order to harvest these organs. They have created a fictitious diagnosis called brain death.
Yes, it's a fiction, and it's the best term is mendacity. It's a lie. It's a deception. And actually, what happens is that we're brainwashed about it, because I just used the term brain with brainwashed, and we know what brain is. Well, then you combine it with brain death, and you hear those two words, and you think of death. Well, brain death doesn't mean death. Brain death means life. And it's in some ways similar to life insurance. Life insurance has nothing to do with life. It only has to do with death, but you can't sell it if you call it what it really is, that it's death insurance, but you can't sell it that way, so you call it life insurance. Brain death means alive, but you can't sell it, and really it's called selling. It's propaganda to get people to participate in the organ transplant industry. And it's a large industry. It's a multi-billion-dollar industry, the organ transplant industry. In 2014, there was $24 billion billed for organ transplantation. And so it's a multi-billion-dollar industry that's completely dependent on getting healthy organs. And where do you get healthy organs? You get them from living persons. Can you get a healthy organ from a cadaver? No. A cadaver doesn't have any healthy organs. And so you can't get organs for transplantation from a cadaver. So they all the organs that are transplanted are all healthy organs, and they are all taken from living persons.
Now, Dr. Byrne, most people would think that when they become an organ donor, that they're doing something great and that their organs will be taken after they die. So I'm thinking that this is systematic deception and manipulation.
It's all deceptions. There are no organs that you can take after death. Once somebody, is the remains of someone, once the remains, it's commonly known as a cadaver or corpse, there are no organs you can transplant from a cadaver or corpse. You have to be alive to have healthy organs, and the common way that they've been getting organs is through this thing called brain death, that someone is declared brain dead, which really means they're alive. But when they're cut open, the transplant surgeon sees the beating heart. The beating heart is right in front of him. And if he is going to use the heart for transplant, when he has the dissection complete, he then stops the heart and lifts it out of the chest. Most of the time, though, they get the other organs before they take the heart out. They get the kidneys and the liver and the intestines and the pancreas and get all of the other organs, and then they stop the heart, because they use the heart and the circulation to keep those organs in good shape until it's more convenient to take the organs out and give them to someone else.
Now, these people are alive as
Yeah.
they're being cleaved open and having their organs removed one by one.
Yes.
The medical profession or whoever is behind the medical profession to generate money.
Yes.
I mean, I also have understood from you that they're not given any anesthetic. They're given paralysis drugs. Did you want to share a little bit about that?
Yes. Anesthetics are used to take away pain, but there are other drugs that are used during surgery that are paralyzing drugs, and the paralyzing drugs make it so that the conduction between the nerves and the muscle gets blocked, so there is no movement. So the anesthesiologist has both of these that he uses during anesthesia, but in the case of anesthesia, so far as taking the organs is concerned, most of the time they give no anesthetic, but they do give them paralyzing agents so they don't move. I say most of the time because they also know that the procedure is painful, and that causes stress on the one that they're taking the organs from. And if they give the anesthetic, then the organs can be in better shape for somebody else. So they do these things to the one they take the organs from for the sake of the one they're going to give the organs to.
Now, there's so many things that are going through my head as you're speaking. So my work has been very deep into exposing the satanic elements of the medical system. And part of what's happening, obviously, when someone's been declared brain dead, and there's also other times that this is happening, we'll talk about that, but they are literally being tortured to death because they're not being given any form of pain relief while they're being sliced open. They are being paralyzed so that they cannot move and they cannot scream, and they're being slowly tortured and murdered to death.
Yes.
Yes. So we have an extremely evil energy that permeates what's happening here, and people really need to get the depth of that evil. Anybody that's involved in this kind of action is obviously a psychopath. If you can look at somebody, open their bodies, see the beating heart, take their organs out, this is systematic, methodical, purposeful. It's evil.
Yes.
Yeah, and these people have to be mentally ill to be involved in it.
It's difficult to think about it like that, but on the other hand, you have to realize that much of the medical profession is involved with this, much of the legal profession is involved with this, and many of the clergy are also involved in this. And how else could it be so widespread unless there is a component, that an evil component that disseminates and misleads people away from the life, but towards the evil of torture and vivisection, dissection alive, to get their organs to give them to someone else.
If we step outside of our culture and out of our mind control, it becomes very, very clear that we're dealing with a very evil force that's running through a large number of lawyers, doctors, clergy. I'm just astounded that that it's been kept hidden so well. And I really have gratitude for people like you who have brought forth the truth about it, because people need to know this.
Yes, and of course, people like me, I'm one of the founders of the field of neonatology. I started a special care nursery in 1963 at Cardinal Glennon Children's Hospital in St. Louis. And the reason I started it is that many babies died. In fact, I reviewed the statistics at 2 hospitals in St. Louis for 2 years. And every baby that was less than 3 pounds and 4 ounces that had trouble with breathing died. It was 100% mortality. We had no treatments. We didn't have any ventilators. Ventilators had to be invented. I was the one that invented how to take blood pressure on premature babies. I worked with the electronic engineers from the astronauts program, and we used the blood pressure cuff that was used on the finger of the astronaut and moved it up to the arm of the premature baby. And that blood pressure cuff is used to take blood pressure in all infants and children all over the world, but that's where it came from. Remember, 1963, no treatments. We started to get some better treatments for breathing in about 1970. Well, what happened is that in 1975, I had a baby, Joseph, in my nursery, who was on a ventilator, and he had been on the ventilator for several weeks, and he didn't move. He wouldn't breathe. When we would take him off just a little bit, he wouldn't breathe. And so a brainwave test was done on him, and his brain waves were flat. And what was written on his chart was consistent with cerebral death. And I saw death on his chart, and I looked at Joseph and I said, I don't understand this. So it was suggested to stop treating him, but I continued to treat him. Eventually, he was able to be weaned from the ventilator. When Joseph went to school, he got straight A's, and he ran track, he played baseball, and he's married and has 3 children. Well, I started to study the subject in 1975. I really knew little or nothing about it at that time. And it took about 2 years until I understood the language of brain death. And in brain death, they mix up and confuse the terms of absence of functioning of the brain, absence of functions of the brain, destruction of the brain, and death of the person. And these things are all used interchangeably, so that and sometimes I'd find them even used in the same paragraph as if they were all the same thing, and they're not. So in the beginning, it was a matter of learning the language, learning what was going on in the field of neurology. And brain death was just invented. The Harvard criteria, that committee at Harvard just published, and they published without doing any studies on dogs or cats. They didn't do any studies on human beings. They just published it, and it made it like it made the absence of the functioning of the brain, which they called irreversible coma. And you can't be in coma unless you're alive. They called it irreversible coma. Then they translated it into brain death, and then they embarked on making it legal. So the Harvard criteria, the Harvard committee published in 1968. Already by 1970, Kansas was the first state to have a brain death law, and all the states have a brain death law now. But they embarked to once they invented it, then they set out to make it legal, and they have made it legal. And the laws are all set up to get your organs. The Determination of Death Act.
Even when you go to get your driver's license, they want to grab your, to get you to say right then and there that you're willing to give them your organs.
Yes, and they ask you, do you wish to have it designated on your driver's license that you want to be an organ donor? And
know people.
and if you say yes, then something is put on your driver's license, like a heart or something like that. But if you say no, that's not recorded anyplace. And then you have to realize that I just mentioned the Determination of Death Act, but there's another law called the Uniform Anatomical Gift Act, which has been passed in 47 of the 50 states. And that makes it that it's presumed that everyone intends to be an organ donor. And it's presumed that everyone has consented to everything to be done to them to keep their organs in good shape till they can give them to somebody else. And this is the law in your state and my state, it says things in there that if you have signed up to be an organ donor at the License Bureau, and then you hear things like we're discussing today, and you go back to the License Bureau and tell them, I no longer wish to be an organ donor, then that is called a revocation. And the Anatomical Gift Act clearly spells out that a revocation is not a refusal, and they can still get your organs. The other thing about the Anatomical Gift Act and the license that everybody needs to know is that when the learners are taking their driver's ed course, the instructors of the driver's ed all instruct them how to sign up to be an organ donor. And they tell them only good things about being an organ donor. And then the learner, if you can recall, at least I can recall when I was 16 taking that first test, I would say that I don't know if intimidation is quite the right word, but certainly we were anxious about passing the test and would be very careful about any answers that we gave to the examiners. But these young people and the law is that when they get that learner's permit, in some states you get the learner's permit when you're 14 and a half, and some 15 and a half. But once you signed that up, then the law does allow the parents to have some input into it. But if you've signed it up when you're 14 or 15, it stays there for always. And once you become 18, then it is on your license and on your record forever. And incidentally, along those lines, it's very important for the young people to learn that when they reach the age of majority, which in most states is 18, no longer do their parents have anything to say about what happens to them if they're unconscious. So they have to, if they want their parents to speak for them, they have to have a power of attorney that designates the parents to speak for them. Because if they don't have that, then if there's some question about it, and the question would come about getting the organs. And I learned this from youngsters, 19 years old, automobile accident, unconscious, on a ventilator. They're away at school. Then the parents come on the scene, but the system is already set up that they go to the court to get the court to designate the person to speak for that young person, and they often do not look to the parents for the one to speak. So the youngsters have to have a power of attorney, and the power of attorney, I would suggest, to designate their mother and father as the one who speaks for them until that they get married or whatever else they would do a bit later in their life.
Let me back up a little bit, because speaking of being a parent and having no say in what's happening to your child, I'm one of the parents that had a child in a neonatal intensive care unit. they did declare my child brain dead. Yes. I did not understand, of course, at that time that what they were after was her organs. And I didn't really feel like I had any power to control what they were doing to my daughter. Because if I had, I instinctively knew that something was extremely dark and evil about what was happening to her. But I felt that I would be arrested or something if I tried to remove her, or that I would lose complete rights to my own child. So they did end up getting her organs, right? Having me sign a form. I really felt tremendous pressure to sign a form. And it was only years later, after talking with you, that I understood that they had tortured her to death. In fact, they tortured her the entire time that she was in a neonatal intensive care unit, because I've written a book, as you may know, called Birth Trauma and the Dark Side of Modern Medicine, and I have discovered that very young children are often operated on, having surgical procedures with no anesthetic whatsoever. They are repeatedly paralyzed while they are in neonatal intensive care units, and very painful things are done to them over and over again. But they are given no anesthetic for this, so they are being systematically tortured. And I compare that to, for example, what's happening in South Africa or Australia, where if a premature baby is born, that baby is strapped skin to skin with a mother or a father or somebody that loves that baby. And that's a 24/7 thing. So the baby never leaves the side of somebody that cares for it. Even if they're doing procedures, the procedures are done while somebody that loves that baby is holding that baby. So as opposed to what's going on in the United States, where these very vulnerable infants are isolated and repeatedly harmed with no ability to connect with a loving caregiver, there are ways to do this that are much more nurturing and nourishing. And of course, those children have a much better, I think they have like a 40% increased chance of those babies surviving than babies in the United States. And that's because in the United States, we tend to be doing things that are the opposite of love, because I do believe our medical system is controlled by evil forces. And I won't go into who's behind it right now. I'm definitely clear about the cult that is behind this. And we'll go into that later, in later shows. For now, I want to lay the groundwork for people so that they understand that what we're up against is truly evil. We talked briefly about, in addition to the brain death, Dr. Byrne, you said there's some other things that they're using now to try to get people's organs. Could you share about that?
Well, brain death was invented to get organs, and of course they advertise often and say we don't have as many organs as we would like to have. So then what they did was invent what they call heart death. And what heart death is somebody who has brain activity, but they want their organs. And so then they take away their life support and they wait till they're without a pulse, not until the heart stops, but they wait until the heart is not beating strong enough to give a pulse. And then they will wait another 2 or 5 minutes, depending on where they are. In Colorado, in Denver, Colorado, it was reported in the New England Journal of Medicine, 2 babies were without a pulse for 75 seconds, for 1 minute and 15 seconds. And then they cut the beating heart out and gave it to other babies, and so the heart death follows the brain death, and again they're always alive with heart death. They're always alive with brain death, And then the thing that is so just disturbing, all of this stuff is disturbing to me, but the thing that is so disturbing now is that the addict who overdoses becomes an organ donor, and they get organs, as many organs from the addict who overdose as they do from automobile accidents. It's so awful because addict, often it's an addict who has gotten himself or herself off the drugs, and then as they're about ready to go back to work, they go one more time, and the dose of drug that they were taking before has such a greater impact now, so they become unconscious. And then there's much campaigning these days to have Narcan available, which counteracts many of the opioids. But what happens is that if they don't wake up immediately, they then become an organ donor. And the brain, when it's depressed from those chemicals, needs time to heal, and of course they quickly embark on getting their organs.
Let me speak to this as well, because again, my work is looking at the other side of life, what's happening as babies are coming in. And we know that most mothers that are giving birth in hospitals today are given opiate drugs. So for example, Pitocin is an oxytocin mimicker. Demerol is also an opiate drug. They're given a variety of things that are opiate drugs, and children then are being born on these opiate drugs. And what this means is that their oxytocin receptor sites are going to be damaged. And it also means that they're going to have a very increased chance of becoming addicted to opiate drugs like oxycodone or heroin when they come into their teenage years or early adulthood. So here we have a setup, okay? We have a setup that's going to be creating a large number of addicts addicted to opiates who are going to end up back in the hospital when they overdose, and they're going to be having their organs harvested. Wow.
Right. It's really very shameful. In Ohio, there are 8 deaths a day from overdose of drugs. That's just in Ohio. And many of them, they get their organs. And they get their organs while they're still alive. They have to be alive, because if they're a cadaver, if they overdose to where they're a cadaver, their organs are no good. If the accident is such that they're dead at the scene, the organs are no good. You have to be alive. The organs are only good when you're alive. And every organ that's transplanted comes from a living person. And in the process, they are either killed or they're made weaker, depending on the circumstances. And when I started to do this work, the question that I searched for, is brain death true death? And the answer is no, it's not. Brain death means alive. And I really did not pay much attention to the organ transplant aspect of it until maybe 5 or 6 years ago, when I was asked some questions about, and started looking into it to find out that what was going on in these matters. And so sometimes someone would say, well, what would happen if it would be one of your family? Well, family, my family, anybody's family, I would have to say the same. I don't think we can't participate. We just have to stay away from it. And organ transplant, the organ transplant industry is set up on the surface to do something good, but in the process of that so-called doing something good, they steal the organs from the one that they call the donor, and and or they kill the donor, they cut out the beating heart. And I suspect that most people, if they knew what was happening with the donor, they would not have anything to do with it. I also suspect that most people, if they knew that they were going to be dissected alive, they would not want that. But they're not allowed to get this kind of information, because if they do have that kind of information, they will get fewer organ donors, and they need organs to have their industry. And the organ transplant industry, as I told you, is a multi-billion-dollar industry. It's larger than the abortion industry, and so it's very serious matter. The person who's unconscious and on a ventilator, they're vulnerable. They're unable to protect themselves and defend themselves. And if they have ever signed anything indicating that they want to be an organ donor, then they odds are they're going to get the organs. By the way, that the organ procurement organization is notified as soon as the patient is unconscious and on a ventilator. And oftentimes, already at the scene of the accident, they make a decision about which hospital to go to. And the one that's unconscious and on a ventilator goes to the organ transplant center. And the organ procurement organization is notified as soon as they're unconscious and on a ventilator. A patient that I recently was asked about, within 2 hours and 15 minutes after being admitted to the hospital, the organ procurement organization was notified. And we've learned that they come around. They are often soft-spoken. Many of them have a blue suit. They dress nice. They are kind to the relatives. Get them coffee, other things. We observe their technique. They assess the family, figure out which one is perhaps the weaker, more likely to give permission to do things like getting the organs, and they'll separate the family, work on them. All of the organ transplant centers have what they call designated requesters. The treating doctor is not allowed to ask for organs because the rules are such that it's only the designated requester who can ask for the organs. All of these are part of the system, the organ transplant industry, and it's going on all the time.
Yeah.
And there's billboards, there's radio advertisements, there's TV advertisements, all showing the glorification of the recipient. And there's little or no information, and no information is more correct, no information given about what happens to the donor.
Now, this industry, people who are interested to understand who's behind this, if you just do a little bit of Google search, will clearly find that this is a Jewish industry, and that many, many, many Israelis and New York Jews, for example, have been arrested for illegal organ harvesting. And this is something people need to research, because we are dealing with a cult, and it's a very vicious cult that is, in my personal experience, I think we're having a situation of attempted soul snatching going on with the torture of people before death. In addition to the fact that I don't think these organs are being used for implantation necessarily, because members of this cult are also involved in the consumption I'm sorry to horrify people, but this is all documented. They're involved in the consumption of human blood and body parts. And they do this also for what they would call spiritual or religious reasons, in order to harvest other people's life force and keep themselves youthful or gain some kind of power or whatever mental illness they're thinking, is very, very disturbed. So I don't believe for a second that these organs, the number of organs that are being harvested, I do not think that this has a whole lot to do with transplantation. I think it has a whole lot to do with satanic or Luciferian rituals. So we need to be aware of that, aware of who's behind it, and doing whatever we can to avoid ending up in the hospital. And if one of our family members, our loved ones, ends up in the hospital, especially, as you said, on a ventilator or in a coma, or as a result of overdose.
There are things that need to be done to help and protect the life of that unconscious person. One is they need to have someone there with them all the time. I instruct that they need someone with their unconscious person all the time. You cannot go away from them. The other thing that everyone needs to learn is that in their determination or declaration of brain death, they do a procedure that they call an apnea test. And everyone needs to know to object, to say no to the procedure of the apnea test. And incidentally, it's a test not for sleep apnea. That's a different thing, and that's okay. Actually, many people have sleep apnea, and the treatments that are used help people a lot. So you can be tested for sleep apnea, but do not allow an apnea test to be done. What they do when they do the apnea test is they take away the life-supporting ventilator. They take it away for 10 minutes, not just for 30 seconds or a minute, but for 10 minutes. And so they're without a breath for 10 minutes. It suffocates the patient. It makes the carbon dioxide go up. The acids go up. It's a terrible, terrible, awful procedure, and no one should ever allow the apnea test to be done. Fact of the matter is, very seldom do they ask for permission to do the apnea test. They just do it, because if they told someone that they were going to suffocate their wife, their husband, their son, their daughter for 10 minutes without a breath, anybody with any common sense would say, no, you can't do that. And yet they do it all the time. It's part of this declaration of brain death. It's a procedure, and I call it a procedure. It's not a test. They call it an apnea test, but it's really a procedure called an apnea test. And you see, a test is that a doctor could shine a light in your eye and see if your pupil responds, or blood could be drawn from you and a test could be done. But in the procedure of the apnea test, they take away the ventilator. They do that procedure of taking away the life-supporting ventilator for 10 minutes, which suffocates the patient. And everybody must learn, every one of your listeners, everyone who views this must learn that if they have a patient, they have a relative in the hospital that's unconscious on a ventilator, they must instruct no to the apnea test. Do not allow the apnea test.
Okay. So you were saying earlier, Dr. Byrne, that somebody should be with the people 24/7. And what are we looking for in addition to the apnea test? What are we making sure doesn't happen to our loved ones?
Well, they need nutrition, and they need proper support of ventilation, and they need other things, but they don't need to have things done to them like the apnea test. And of course, if they're there with them, then that also assures the person who might not be able to manifest consciousness, but they could be have some awareness of people around them, and it helps to have someone around who loves you. So stay there. The other thing that I do is that I encourage people to put it in writing that they don't want the apnea test done. I also encourage them that they want everything done that will protect and preserve their life, the life of their loved one, and not do anything that's going to harm them or shorten their life or hasten their death. And they have to put it in writing. And if it's in writing, then they have a better chance. And you know, what occurred in Germany and what occurred in Japan is that these patients, if they did not get the apnea test and if they continued to treat them, 60% of the patients made recovery. And you know, now I have a patient, Jahai McMath, who's a 13-year-old girl who was in California in 2013 and had tonsil surgery, and then they declared her brain dead. And we got involved with treating her. She had to be transferred to New Jersey to continue to get treatment. She's had her 13th birthday, her 14th birthday, her 15th birthday, and her 16th birthday. I got to back up. She didn't have her 13th. She was already 13, but she had her 14th birthday, 15th birthday, and 16th birthday. And I got an email from her mother just yesterday. That's Jahai. There's another little boy, Alan, who almost drowned on July the 22nd. Again, they were quick to declare him brain dead, and then we got involved with him. He continues to live. He went home from the hospital on December the 7th. I can remember it because it's Pearl Harbor Day. But he lives at home with his mother and his father, and he would have had his organs taken out. All of those people would have their organs taken out, distributed all over the place if someone, but because they have a mother, a father, someone who loves them and speaks up, and then we get involved. And my goal and objective is not simply to expose the falseness of brain death, but it's to develop better treatments for these patients. When the brain swells, it stops making thyroid stimulating hormone, and the patient gets deficient in thyroid. And when they're deficient in thyroid, that makes the body swell, and that makes the brain swell more. And if you give them thyroid, it cuts down on the swelling of the brain and helps their brain to heal. So thyroid nutrition, we pay close attention to nutrition to get the vitamins and the proteins and the other nutrients that they need for healing of the brain.
How do people reach you if they have a loved one that's been diagnosed with brain death or whatever? How would they reach you to get help from your team? I guess you have a team of people that.
Well, they find me, lifeguardianfoundation.org, and www.lifeguardianfoundation.org. That's the commonest way. There's another website, Truth About Organ Donation, and they contact that one too, and then they find me. Okay. If you Google brain death, my name comes up pretty quickly.
Right on.
At least it does. And then they find me. And of course, the sooner that the treatment to protect and preserve the life is done, and I'm talking about the life of the person, not simply the life of the organ, but the life of the person, the sooner it's done, the better chance they have to continue to live and recover.
Yeah. One other thing I wanted to say is that regarding the apnea test and the slow suffocation and torture of people in neonatal intensive care units, my research, and this is in my book again, Birth Trauma and the Dark Side of Modern Medicine, which you can find on my website at birthofanewearth.com or at Amazon. They've been doing this to babies as well, slowly suffocating babies. Since the 1950s, they repeatedly come in and do research, according to them, to discover the sweet spot for how much oxygen a baby should be given. So they take a group of babies and they give one baby, too much and another baby too little, ostensibly to find that sweet spot. But they've been repeating this research for almost 100 years now, right? Again and again, or 70 years. They've been doing this sadistic torture of infants, the most vulnerable, premature infants. And you have to wonder about this. I mean, why is it taking them this long to discover the sweet spot? They know if the baby gets too much, it might go blind. If it gets too little, obviously, it's going to die. It's going to be slowly suffocated to death. It's like there's no question that there's a sadism going on behind this. We know that the scientific community has been involved in vivisection, which is very similar to what they're doing to humans. They're doing it to animals and humans. So we're dealing with a force that is anti-life, that feeds off of the torture. And we have to not only admit that that's happening and that that's running the show right now with the scientific and medical community, but we have to figure out how to deal with it. Because, if we're part of God's design, this is unfathomable to us, to do this kind of cruelty and brutality and hideous abuse and torture. It's something we can't conceive of. It's very difficult and painful to learn about it. But we have to address it, and I'm very grateful to you for your willingness. We're going to wrap up the show any minute now, so I just want you to be able to say any last things that you feel people should know.
Well, be aware, do not sign up to be an organ donor. If your loved one is in the hospital, unconscious, be sure that you stay with them and instruct no to the apnea test. It's very, very important. And help the young people to know that they should not be an organ donor. And when they get that learner's permit and then their driver's license, they should not sign up to be an organ donor. But no matter what, the laws are set up that it's presumed that you intend to be an organ donor, and it's presumed you've consented to everything to keep your organs in good shape until they can find someone to give them to.
And also, if you go into a doctor's office these days, if they give you this HIPAA form, you better read that HIPAA form before you sign it, because on that HIPAA form, sometimes it says you agree to let them have your body.
Yes.
And your organs.
Right.
So I will never sign that HIPAA form.
The HIPAA law is part of all of this, by the way. The HIPAA law followed and came about after the Clinton, the Donna Shalala of the Clinton administration issued an executive order that the hospital must notify the organ procurement organization. And then when they passed the HIPAA law, they put it into the statute. In the HIPAA law, there's 14 ways that the government can get your information and use it without your permission. And that's part of the HIPAA law. And when you sign that document that you're talking about, you have signed something that's important. But even if you haven't signed anything, they can still get your information.
So, I mean, this is a time on our planet where we need to be hypervigilant, absolutely, for our lives and the lives of the people that we love. And I can't thank you enough, Dr. Byrne, because it's people like you that are really bringing this into the light, so that are really doing God's work. And I
thank you, Jeanice, and you keep on to ask God to bless you and stay with you.
Yeah, thank you very much.
Okay, bye.
Bye for now. And to all the listeners, we'll see you again next week. Thank you so much for tuning in. God bless everybody. Bye-bye.
Bye.